In this video, I'm going to tell you four red flags that you should consider when you're making a decision about getting a COVID booster for you or a family member. We've been bombarded in the media with reasons, pleas, and mandates to get vaccinated. But I wanted to give you a few things that says, wait a minute. So here are the four red flags. I'll give them all to you, then I'll break down each one. Now, I'm not saying you should or should not choose to get boosted, but I believe there are four things you should consider. Are we being manipulated? Are we being coerced? Are there worrisome risks or safety issues? And is there transparency? So here we go. First, manipulation. I don't know about you, but when I feel like I'm being manipulated, I automatically start thinking, what do they want? Like when a patient comes to see me who's overly complimentary to me or my practice, well, I bathe and try to look presentable, and I have a good reputation in the community, I think. But I'm no J.D. Dory. Well, 9 times out of 10, they want control drugs. So what sent up my antenna? First, the pleas to the common societal good. We started seeing commercials on TV and social media. The commercials weren't just to inform the public about the shots or how to get them, but to suggest you would be a better person if you got vaccinated. We should all do the measures they thought of for the common good. If you were on social media, you started seeing frames around Facebook and other profile photos, messages like, spread the hope, not COVID. I got my COVID vaccine. I'm vaccinated. Together we can prevent the spread, and many, many more. Someone from Austin Public Health got really active and made a whole set. My reason for vaxxing is to travel, the right thing, my health, my community, and last but not least, my family. And on social media, at least, discussion of who should and should not be vaccinated wasn't allowed. Then when the vaccine rate started slowing down in 2021, and again this year, various localities tried to bribe people to get vaxxed. The latest was in Boston, Massachusetts, where you can get a $75 gift card for anyone, man, woman, or child, to get their first, second, third, or fourth vaccine. Why do they have to pay people to take something they don't seem to want? I at least give them credit for giving them money. We can only hope the parents aren't using it to buy drugs, hookers, or lottery tickets. Then we have the politicians and all manner of experts and celebrities appearing on TV and in social media stating that you have to get vaccinated so you won't spread COVID. It has been acknowledged, though, that getting vaccinated does not protect the community from the spread of COVID. The initial studies showed a decrease in symptomatic infection for 2 months, but it is apparent to everyone, I think, that the initial 2 or 3 shots is not effective in keeping you from getting COVID long term. And if you get boosted, no one knows how long any benefits will last. So first we were being manipulated, now coercion. Many social media outlets we know have been rather heavy-handed in their COVID policies by blocking or removing or censoring any speech that opposes the government line. We know now that these practices were pervasive and extensive. They often pointed to fact checkers who were simply journalists that also towed the party line. Some people's livelihood was threatened for speaking out and their accounts were banned. And just as I said before, peer pressure was used. We had and still had coercive mandates. If you did not get vaccinated, you lost your job. I thought it was rich when the hospitals that a few months before praised the sacrifices of the frontline medical personnel and then fired them if they chose not to be vaccinated for various reasons, including natural immunity. Police departments and fire departments were gutted, not by the virus, but by bureaucrats. These heroes had their livelihoods threatened. Some suggested denying health care to the unvaccinated. One comedian even joked that if you had 2 sick people in the ER with heart attacks, that you treat the vaxxed one and let the other one go. I guess we found out that my body, my choice only applies to certain things. At least we have good news, and it appears the military is rescinding the vaccine mandate that was causing so many people to get out. This ostracizing of people is just a coercive bullying tactic. And so now we come to the worrying risks. There are many people that have attributed to the vaccines all types of things, but I'll only mention two that no one denies. First, myocarditis. It's a real risk for young men receiving the vaccines. But I talked to a former officer in the military in his 40s who suffered post-vaccine myocarditis a few weeks after being forced to get vaccinated. And no one really knows the true extent of the long-term damage in those who suffer it. When you consider young men, the vaccine doesn't really reduce the risk of dying from COVID very much, since they don't have a very large risk of dying in the first place. Finland and Sweden are limiting the use of Moderna's COVID-19 vaccine in young people over concerns about rare cardiovascular side effects. Germany and France restrict Moderna for those under 30 due to heart risks. Then there's still concern about blood clotting from certain COVID vaccines. The U.S. Food and Drug Administration limited the use of the Janssen vaccine, which is a viral vector vaccine, due to the risk of thrombosis with thrombocytopenia syndrome. Then there are the various adverse events databases around the world. The number of reported vaccine injuries seems staggeringly large, and we're all still waiting for answers to those. So, lack of transparency. In the original studies, I think most people now know that the ones done by Pfizer and Moderna were very rapid, 3-month studies that claimed remarkable safety and efficacy, 95% protection against hospitalization and serious illness. The preliminary results provided to the government bodies were used to grant emergency use authorization. But for some reason, the research summary and not the data was released. I understand the reason was because the studies were still ongoing, but when they were taken to court to require release of the data, they claimed that it would take decades to release the 80,000 pages of data. The initial studies did not check and did not show that the vaccines prevented mild or asymptomatic infection, and they did not look at whether they stopped transmission. They did show that they reduced the risk of symptomatic infection by 95% for 3 months. We now know that that's about the duration of the prevention. Certainly, the high-ups and all the big pharma producers have known this, and probably the FDA did too. Why didn't they correct the record when politicians and others made claims that were counter to the evidence, or that there was lack of evidence? It is a lack of transparency, in my opinion. One of the hallmarks in healthcare in the United States and other places is informed consent. Every patient has the right to get information and ask questions before a procedure or treatment. But when the information is not even transparently provided to the healthcare providers, and we're basically told, just trust us, then that is a warning sign, a red flag. Let me be clear. I took the vaccines as soon as they were available, and also the first booster. Team Moderna, yeah. I'm not anti-vax. Clearly, for the elderly, those with chronological or physically advanced age are at high risk and do benefit from the risk reduction that the jabs provide. I always try to consider risk versus benefit. The issue is the lower age. The lower the age, the risk drops off precipitously to the point where teens and children have a statistical risk that is so low it seems meaningless. Is the risk from COVID zero in those below 30? No, but I don't think you can say that the risks of the vaccinations are so low that they aren't significant, and at the same time say that about the risk of serious complications from COVID. Of course, there's always exceptions and factors that might shift the scale toward or from the decision to be vaccinated, but that's why it is a private decision that should be made on the basis of good medical advice with your healthcare provider. Thank you for watching. Be well.